The first New York City inmate with COVID-19 has died. His name was Michael Tyson. He was 53 years old. He was being held at the well-known Rikers Island jail complex. The city reports that the medical examiner has not officially determined Tyson's cause of death, but his passing comes amid continuing calls from criminal justice advocates to release inmates nationwide as the coronavirus continues to spread.
Reuven Blau has been covering this story, and he joins us now. He's a reporter for the city. Reuven, first off, tell us more about Michael and his situation.
He was in on a technical parole violation for missing a meeting with his parole officer. He had a prior charge of attempted rape and a history of 7 other felonies that he was in state prison for over the years.
So I think almost 2 weeks ago, Governor Cuomo in New York declared that, some inmates would be released from the jail. And the idea was to release some low-level, nonviolent offenders, or maybe people who were there for a parole violation or who were awaiting a court and maybe hadn't been found guilty of anything. But he keeps having these press conferences and people ask him about that. And the numbers of inmates released way lower than what had been promised.
Exactly. They actually have a population of a couple weeks ago was about 600, a little more than 600 people who were there on technical parole violations. The governor announced that they were going to release some of this population. And, like everything else, when they make these announcements, it's kind of the devil's in the details. And the details are they're actually dividing the categories of these parole violators into 3 different categories, including people who might have had minor transgressions or minor issues. But it's limited. There's limiting the number of people who are actually getting released. Medical staff in Rikers Island is saying, we are really concerned. We're worried that unless you release this entire population, there's going to be a serious problem with coronavirus, and it's just going to spread like wildfire amongst the population.
So what are the conditions like, Reuven, at Rikers and other jails and prisons in New York City? Are they equipped to handle an outbreak like this? I mean, most New York City hospitals aren't equipped, so I wonder what it's like in the jails.
It's a real mess. I've been covering the city jails and Rikers Island especially for the last close to 20 years, and I've never seen a medical staffer go publicly on Twitter or publicly announce on Twitter that they are concerned. They're concerned for the lives of elderly inmates or inmates who might have health issues. And, it's really, really just an incredible break of protocol for someone to kind of go out there and say that, a city official to say that. And they're begging for the mass release of up to 2,000 inmates. So far, the city has actually gone out, and the city and state with combined powers have released close to about 1,000. But they're saying, look, that's not nearly enough. And right now, close to half of the jail population, which is about 5,000 people right now, is been quarantined, is in isolation. About 300 inmates have COVID-19, and there's been up to 4 correction staffers who have passed away due to COVID-19 complications. I've just heard today that there was a chaplain who died yesterday. There's a real concern that this is just the beginning unless there's more and further action that's taken. And on the prison front, there's a lot of the advocates are pressing Cuomo to do more with clemency. He's barely released anyone over his tenure on the clemency front. And they're saying, look, unless you start doing this and using your powers, this is going to be a real problem. And it is just the beginning. They have barely tested anyone on the prison population. And they're basically saying, hey, look, unless you're really, really sick, we're not going to do anything. And they've actually had 2 fatalities, including one who was in Sing Sing, who was never even hospitalized, who died in the prison itself.
So, this is something that states and municipalities around the country are going to be watching. They're going to be watching New York because New York is at the leading edge of this virus. It's the current epicenter in this country. And so how New York handles this virus is what many other municipalities are going to learn from. And I want to remind people when they think about, inmates and they sort of roll their eyes and say, hey, if you didn't do the deed, then you wouldn't find yourself in this predicament. There are an awful lot of people who couldn't make bail and haven't actually had a court case yet and are behind bars waiting for some sort of justice or judgment. And they're finding themselves very susceptible as well. So I imagine, Reuven, that around the country, people are watching what they're going to do in New York. What can they learn from watching New York?
I mean, I think the real argument is that people who are older and sick, you know, and who are in there for minor violations or low-level offenses, there needs to be a real serious look and quickly to put them outside of these facilities where they're surrounded. It's impossible to social distance there. Hygiene's a mess. You know, and you mentioned that some of these people, you know, are in for bail. I mean, it's less bail right now than it is on the parole violators. And people can violate their parole for either failing a drug test or just missing a meeting with a parole officer. It's really not committing a new crime in most cases. And I think that's really the population that at least the city right now is trying to, in the state, is trying to focus in on.
Some excellent reporting there from Reuven Blau. Reuven, as always, we thank you, my friend. Stay safe, be well.
Thanks, you too.